Can immunotherapy combine with other cervical cancer treatments? Imagine a treatment approach that uses the body's own defenses to fight cancer more effectively. That's what immunotherapy aims to do, and yes, it can be combined with other treatments for cervical cancer. This combination strategy is currently being actively studied in clinical trials and shows promising potential to improve patient outcomes. Immunotherapy for cervical cancer mainly involves drugs called immune checkpoint inhibitors. These drugs target proteins like PD-1 and PD-L1, which cancer cells use to hide from the immune system. Two key drugs approved for cervical cancer are pembrolizumab and cemiplimab. Pembrolizumab is approved to be used with chemotherapy, sometimes along with bevacizumab, a drug that blocks blood vessel growth to tumors. Cemiplimab is used when cervical cancer comes back after chemotherapy. Researchers are exploring many combination options. One common approach is combining immunotherapy with chemotherapy. Studies have shown that this combo can lead to better survival rates than chemotherapy alone, especially in advanced cases. For example, adding pembrolizumab to chemotherapy has improved outcomes in clinical trials. Another promising area is combining immunotherapy with radiation therapy. Radiation can make cancer cells release more antigens, which helps the immune system recognize and attack the tumor. Ongoing trials are testing how well this works and whether it's safe. Some studies are also testing dual immunotherapy, where two different immune checkpoint inhibitors are used together. For instance, combining PD-1 or PD-L1 inhibitors with CTLA-4 inhibitors. While this approach has shown higher effectiveness in some other cancers, it can also increase side effects, so researchers are carefully studying the balance of benefits and risks. Because cervical cancer is often caused by human papillomavirus, scientists are developing immunotherapies that target HPV-specific proteins. These treatments aim to train the immune system to attack only the cancer cells infected with HPV, potentially making treatments more precise and reducing side effects. Combining these targeted immunotherapies with other treatments is also under investigation. It's important to remember that combining treatments can increase the risk of immune-related side effects, which can sometimes be severe. The best combination, dosage, and timing depend on each patient's unique situation. That's why ongoing clinical trials are so important. They help determine what works best and safest. In summary, combining immunotherapy with other cervical cancer treatments is a promising and evolving approach. Approved options like pembrolizumab with chemotherapy are already in use, and many other combinations are being tested to improve results. Always consult healthcare professionals to understand what options are best for individual cases, as treatment decisions should be personalized based on the latest evidence and patient health.